Hi, I'm Carolyn Johnson, and I am the owner of Serenity NP. And I've been a nurse practitioner doing mental health for the last 6 years, women's health for much longer, 15 years, and now doing integrative medicine. So I'm combining all three together here at Serenity NP. So my hope for you guys with these videos is to just introduce myself to you. You can get to know me a little bit, but then also to educate you and to offer you some hope and to know that there are some other options out there, that things are changing in medicine and that we are pioneering the way in that. And so if you know of anybody who might be interested or might benefit from any of this information or from working with me, forward this on to them, comment down below. Let me know. I've been a nurse practitioner since 2005 and always have had an interest in women's health. And in nursing school, we're all on our journey to explore, where we're supposed to be, where we're supposed to make our mark in people's lives. We don't go into this field, unless we're servants. And that's my job for people is a servant and a guide, really. In my journey as to the kind of client that I should be working with. Originally it was going to be pediatrics. I love children, so I love young people. But then it was geriatrics because there's that specialness in the aged. And but then I came across women's health, NICU, babies. Ooh, give me them babies. So anybody, moms, postpartum depression, perinatal depression, those kind of things, anxiety, those are, near and dear to my heart. And so, bring your babies along. They're welcome here. But there was always this underlying interest in mental health. Now, where I was going in nursing school, mental health was always kind of over here and everything else was over here. But having said that, it really is all throughout what we do. When you see someone on a med-surg unit, you do have to deal with a psychiatric piece, whether you realize it or not. It's how you meet, always as nurses, how we meet people where they're at. And so our job is to gauge that situation and to listen, and then talk. And then you can decide how you treat that patient. And so if it's someone you're teaching them how to give an insulin, they're newly diagnosed diabetic and you have to teach them how to give themselves insulin. Well, you have to meet them where they're at because that's really scary, right? So all that to say, I've always had this underlying piece of interest in mental health just because of my own journey in mental health in my family. There's a long history of mental health issues in my family. And so I always tell my clients when the time is right, that we all have our journey. People doing mental health aren't doing it. They're usually doing it because there's some sort of a story behind it. And so I find that, hopefully gives us lots of compassion in what we do. Is it perfect? No. Can it be ugly? Yep. But isn't that who we are? So it's learning how to meet people where they're at. Implementing this women's health piece with a mental health piece, a psychiatric piece, that started about 6 years ago. I was at a lovely practice where we had lots of therapists, and it was myself, a couple of prescribers, and they brought me on board specifically for my women's health expertise, but also because of my desire to do things with as little medication as possible, obviously using it when it's necessary, but really incorporating that holistic approach to care. And so now here we are 6 years later, and I'm now in my own space and get to really expand upon that and offer really my hope and dream and desire is for a comfortable, welcoming, healing place where people can walk in the door and they just leave everything that they just walked away from at the door, and they can come in here and find some peace, even if it's for 15 minutes, with their visit with me, with their interaction with reception, just with a calming experience. That's my hope here, is that people will come here and just drop their bags, so to say, at the door and come in and just breathe for a little bit before they have to leave again and go back into whatever journey they were on prior. In my practice, I've noticed that just with my traditional training, I didn't have enough tools to offer people to get to the root cause to feel better. Medications weren't enough. And so my desire was to keep looking at what other things I can offer people to help them feel better. So really trying to just broaden my toolbox. So many people are interested in that, and medicine needs to change and it needs to start somewhere. And so I'm finding that a lot of my clients are really benefiting from offering a holistic perspective to their care. I say integrative because integrating traditional medicine with a holistic root cause, so to say, approach, I'm finding is really more of the premise, more of the basis to helping people heal and heal more fully than just offering medication to whatever condition we're treating. I treat a lot of depression. I treat a lot of anxiety. A lot of women with hormonal changes. The hormones really play a part in our mood health. And so aside from just throwing medication at people, they're anxious, let's look at why you're anxious. I always like to say that it's like if you're driving your car and the check engine light comes on, you don't put tape over the check engine light. That's anxiety, that can be depression. And so you go and you look, you take it to the mechanic and you say, my check engine light came on, so why did that come on? So you look at the why. And I like to say that anxiety and depression is the same sort of thing. Why is that? Well, your hormones could be off. They could be out of balance. They could be low. And there could be many reasons for that. It could be PCOS. It could be thyroid disorder. It could be a micronutrient deficiency. And those are things that in traditional psychiatry, a lot of times you're not getting. It is changing. I do believe it's changing. Lots of good cutting edge research out there. So that's why I incorporate that perspective into the way that I practice here at Serenity NP.